give folks a moment to join. We have lots of folks still coming in about another 30 seconds, and then Bobby will kick it off to you to get us started. All right, you want to go ahead and kick us off there, Bobby?
Happy to do so. Good morning, everyone, and welcome to the monthly ACT-IAC Health COI meeting. We're very happy to have you. Looking forward to a phenomenal discussion today on what I consider to be one of the best papers ever created by ACT-IAC for a federal agency. And as you all know, based on your registration, this is a discussion today about the paper that ACT-IAC created for the VA called Policy Considerations for the Use of Synthetic Healthcare Data. Now, as you'll see, as the conversation evolves, it's really more about the use of synthetic data than it is about synthetic healthcare data. This is a very broad subject, and we are very blessed that the Kshemendra not only asked us to get involved, but sees this as a potential government-wide initiative. And this is the start today of rolling out this paper and this discussion and just really energizing people around this topic. I want to thank all of the authors who were involved in the paper, Brant Horio, Mary Evanston, Robert Purnell, Tina Den, Kimberly Perlia, and Kelly Winter, who is our ACT-IAC Health COI member that really led this project. There were other folks that were involved as well from Ann Brothers, Crystal Eden, Shannon Ball, and Clayton Graham Holland. Just a really big team of folks that got involved. And you're going to see as this discussion evolves today, it's really an exciting topic. I made fun of the topic when we first picked it up, that it's like, oh, it's the topic no one knows anything about. But we have found that is a shame that people don't know more about this. And so this conversation today. With that, I want to turn it over to our first speaker, Mr. Kshemendra Paul, who is the CDO at the Veterans Administration. And not just the CDO there, really a go-to guy with a great personality who was very open to these kind of experiences and is more than generous with his time. We had numerous meetings with him and his team, and Kshemendra, who is the CDO, found a way most of the time to be in these meetings and to be actively engaged, to be just a real partner with us. And Kshemendra, we thank you very much for that.Kshemendra's got about 17 years of federal service and about 20 years of industry service prior to that. And he has been all over the federal government from his time at the VA as a CDO. He was also at the Department of Homeland Security, the Office of the Director of National Intelligence, the Executive Office of the President, the Department of Justice as well. And he's been doing data and cloud and program management and architecting, which really sets him up perfectly to be the guy at the VA. And with that, Kshemendra, I'll turn it over to you with this question. Why did you ask us to get involved in this in the first place?
Thanks, Bobby, and thanks for hosting this panel and having me and my colleagues and partners at VA as part of the discussion. You know, listening to you introduce me just reminded me about how I keep a step ahead of the debt collectors by being a moving target. I highlighted this because, well, a few reasons. One is I've worked with ACT-IAC for a number of years, and I really appreciate the role of ACT-IAC as a safe space for collaboration between government and industry, to share best practices, to really focus on improving the business of government. And really wanted to highlight the valuable role and niche that ACT-IAC fills. Working with the healthcare COI on this topic, why is it important? Number one, it's clear that we need to do more with open data, with data sharing in the government in general because of Evidence Act and Data Act and just years of policy. There's a real hunger to do this. Specific to VA, data is our superpower. We have so much data at our disposal about healthcare and benefits serving veterans. And if we can rip the cultural and structural kryptonite from our chest and integrate that data, manage it, we can better serve veterans and frankly, position VA leadership broadly to help lead American healthcare and wellness by really adopting evidence-based, data-driven approaches and through the opportunity for innovation around our data assets. Synthetic data is of a lot of interest. The computer science community, the computational privacy community, the statistical community, the health informatics community is all paying attention to this. And there's been a lot of research and frankly, validation, in important parts of the government and elsewhere around the role of synthetic data. But we take our responsibility to ethically use and share veteran information. It's our touchstone, our North Star. So, having that risk-based conversation about how do we build policy transparently, iteratively with our partners in alignment with federal and industry and marketplace best practices is a top tier kind of issue. And I felt like chartering a paper like this in an open and collaborative way with a group like ACT-IAC would really help advance the policy and risk conversation, right, to pair up with the research community, and all the rest. And at the end of the day, VA is one of the leaders in open data research, working with affiliates and partners across the country. But we need mathematically provable ways of enhanced sharing of information. And I think synthetic data has the potential to help us with that. And so here we are.
Kshemendra, you're to introduce Dr. Clancy.
Oh, okay, yes. Thank you. Thank you for prompting me. A key partner of mine, a real pleasure to work with her as a colleague, to learn from her, is Dr. Carolyn Clancy. She is the Deputy Undersecretary for Health, runs our academic affiliates programs, runs our research programs, one of the crown jewels of American healthcare. She and I have partnered since I've been at VA on topics of information sharing, data management, and doing that to better serve veterans. I'm reminded of a time in the summer of 2020 when she and I co-hosted a data summit around suicide prevention, which sparked the ideas around the use of synthetic data, and we've been able to carry that forward. So Carolyn, so nice, and it's great that you're on this panel and can represent VA and carry forward your perspective.
Thanks so much, Kshemendra, and good morning, everyone. Can you hear me okay?
Yes.
Great. I am really, really thrilled because I've interacted with ACT-IAC before by this invitation to speak about privacy preservation and data sharing to accomplish government missions. Privacy preservation is a priority across VA. I learned this literally my first week on the job 8 years ago. Someone had asked me to send a CV, which at the time, I'm embarrassed to admit this, had my social security number on it. Let me just tell you that went nowhere. And I've been learning ever since. But it's very, very clear that we need to find ways to use reliable and timely data to identify and address issues impacting our veterans while also ensuring privacy. So we believe synthetic data modeled to precisely mirror real veteran data while protecting veteran privacy is a great path forward. For example, VA seeks to understand the current state of key data efforts, as Kshemendra mentioned, in suicide prevention including confirming and clarifying ongoing veteran challenges in order to make meaningful changes. And to give those of you who aren't from VA a little bit of context here, there's roughly 19 million veterans in this country. A little over 9 are enrolled in our healthcare system, and there's a number of other veterans who interact with us for benefits like GI Bill and mortgages and so on and so forth, job retraining. But when we say that we want to eliminate or reduce at least to functional zero veteran suicide, we're not just talking about the veterans we connect with, we're talking about all veterans. So we have internal predictive rules which have served us reasonably well, a good start for the veterans who get their care with us in terms of predicting those at the very highest tier of risk of suicide in the coming time frame. But we need to reach and identify all others. And I think with the coming of the new 988 number, right? We've had a crisis line since about 2007, I believe, and now the country is going to have one. Great that there's someone to answer the phone, but then what? And how do we prioritize and so on and so forth? So Kshemendra mentioned the Data Summit for Suicide Prevention. This was a collaborative effort hosted by VA's Office of Enterprise Integration, the VA, although I think of it as the Chief Data Office, but never mind, the VHA Innovation Ecosystem, the Office of Research and Development, and the Office of Mental Health and Suicide Prevention, which oversees all of our clinical operations. So the goal here was pretty straightforward: to understand how can we collectively remove barriers and improve data policy, information sharing, and analytic tradecraft, if you will, and collaboration, with suicide as the central use case. One of the main challenges identified was data security and ensuring veteran privacy is protected. So a proposed solution to improve data security is to develop an easy pathway to generate synthetic data that is confirmed as privacy preserving and meaningfully mirrors raw data. The good news is VHA now has a cloud-based platform in which synthetic data can be generated. And of course, you're waiting for the other shoe to drop. The difficulty we have is around policy. Currently, we don't have any policies, and I don't believe that this is limited to the Department of Veterans Affairs, that could directly relate to synthetic data and its use. Because of that, my colleague Amanda Purnell, who you can see in the Hollywood squares here, has met so many people across the department as she tries to push some of these efforts forward, because probably the greatest challenge in a large bureaucracy is when we don't have a policy, so no one actually knows what to do or what to say. Because we have no policy, there's difficulty standardizing and using synthetic data across the enterprise to encourage improvement of veteran care. So white papers like this one, Policy Considerations for the Use of Synthetic Healthcare Data, and collaborations with external stakeholders like this Community of Interest and other federal entities, are pivotal to helping VA advance and move towards the necessary policy development and implementation. This issue of policy not quite there is hardly limited to synthetic data, right? It's also about, every time I am hearing someone spout about their fantasy that, you know, we can give all veterans Fitbits or fill in the blank and we can collect all this health data, and employers regularly talk about this for their employees. We have no rules of the road for that kind of data either. So I'm very much looking forward to hearing from the panel and all of you about the future of synthetic data and how it can be used to help address our most significant and mission critical problems. Thank you for the opportunity again.
Thank you, Dr. Clancy, and thank you, Kshemendra, for your leadership on this and for your interest in this kind of a topic. As someone who read this paper as a page turner, I'm really excited about what this panel is going to talk about today, and to hear them go into more detail in some cases past the paper. And we're very fortunate. We've got a great panel, and we've got a great panel moderator today. Mary Evanston with ICF is going to be moderating our panel. Mary has been in industry for over 20 years now, serving the needs of multiple government agencies and departments, and has spent time with Lockheed, with Booz Allen, with IBM, and with AT&T. And I mentioned she's with ICF, and in the spirit of Black History Month, a little bit more about ICF. ICF stands for the Inner City Fund, and it was founded back in 1969 by a former Tuskegee Airman to finance minority-owned businesses here in Washington, D.C. So a great tie-in to Black History Month. And with that, Mary, I'll turn it over to you to moderate the panel.
Thank you, Bobby. So I am going to kick off the first question to Brant. And I think all of the bios were up on the web, so I won't reintroduce everyone. Brant, so there's a concept in the white paper where we define the synthetic data life cycle. And I know that was a new paradigm for all of us as we were writing the paper. Can you elaborate on that concept, why it's needed?
Sure. Thanks for the opportunity also. I really worked with a great team. It was a really good team effort with a lot of folks in writing this. So to kind of address that question, this topic of synthetic data is really deep. It's this really rapidly growing field. It's in the presence of this landscape of technology startups that are increasingly showing up. So just trying to talk about synthetic data in general has a potential of being a really sprawling conversation. So to address it, we primarily meant this lifecycle framework as a way to meaningfully decompose the topic into categories that we believe could effectively capture and classify these areas of synthetic data risks and policy-making opportunities. So really briefly, the lifecycle starts with synthetic data sources, or in other words, what am I starting from? How do I think about ground truth into synthetic data generation and validation? Or in other words, how can I build it and how can I trust it, which is very important, as you've heard from the prior speakers. Synthetic data management and governance. So what do I do with it now that I've made it? How do I protect it? How do I manage it? And then to finally, synthetic data use, which is really about how do I appropriately use it for my intended purpose while still protecting the data. So in the paper, you'll see this framework. You'll see sections that are dedicated to each of these different areas. It provides some high-level background insights from experts that we interviewed in academia and in government, some identified risks and recommendations for where we think policy focus should be directed. We don't think it's fully comprehensive, but we think it gives a really good start for continuing the discussion for policymaking.
All right, thank you, Brant. I am going to direct the next question to Dr. Purnell, Amanda Purnell. I'm gonna wait for you to turn your, there you go, there you are. Oh, now we see Brant again. All right, I'll figure out the video is gonna get fixed. So Dr. Purnell, so a core use case for synthetic data is training artificial intelligence and machine learning paradigms and algorithms. Can you talk a minute on the core issue of AI model observability and expandability and the potential for that to be inverted to unmask PII?
That's a great question, Mary. I want to, before I dive into my specific comments, I really want to pile on with all of the previous comments about how pleased I am with the quality of work being done by the group who wrote this incredible paper. It's highly readable and I think actionable. So being able to do both of those in one paper is a true accomplishment. Related to this specific question of AI discoverability, I want to begin with what Kshemendra noted, that our first and highest priority is ethical use of veteran data. And in fact, there's a fantastic document that's been created by multiple stakeholders internal to the VA that's accessible with a simple internet search of ethical principles for access to and use of veteran data. So the first thing I thought about with this question is that we create and make use of veteran data to serve veterans. The goal of using the data that we have access to is to improve care pathways, to improve proactive efforts to engage veterans in care, improve access to services, improve access to veterans benefits. The reason that we pursued synthetic data is a clear signal that de-identified data is insufficient. So as other people have noted, synthetic data might be a niche topic, but within those individuals who are expert in data privacy, it is clear that de-identified data is extremely insufficient for current computational technologies. And so we're pursuing synthetic data because it's easy to re-identify de-identified data. And we can, of course, share data specific to a purpose, and we want to only do so for a specific purpose. But the reason that we're pursuing synthetic data is that it is significantly more advanced technology as compared to removing content from original data. So the technology that we're pursuing is the ability to create an artificial data set that does not have original data in it. So while AI is amazing, AI cannot do all things. So while there's concern, and we should continue to be very careful with privacy, the difference between synthetic data and a de-identified data is night and day for the security and privacy of our veterans' data. Thank you.
Thank you for that. And we're going to pivot over to Eddie. Eddie Thomas, get up on your camera there. Here's your question. So what is the most important problem that you believe will be solved if the VA can guarantee differential privacy with synthetic data?
Thank you. So I'll start with, the Evidence-Based Policymaking Act makes it not just a good thing to do, but a legal requirement to share the data that we generate with the public, providing benefits and services, but also data we use to make policy decisions. But with that, we also have a legal obligation, as Kshemendra and Amanda and Dr. Clancy mentioned, to protect the identity and confidentiality, the confidentiality of veterans and their families. Now, this requirement, coupled with advancements in computing power and re-engineering techniques, increases the risk of disclosure or data breaches through re-engineering, by re-identifying individuals, by linking anonymized data with open data sets. Amanda alluded to that. Or reconstructing PII through the mosaic effect, where you have data we've already provided in aggregate tables, or that's been provided by other federal agencies. And these can be linked to identify personal information. So we have the obligation to, one, provide or generate and use high quality, accurate data, so accuracy. And then we have the legal obligation to make that data accessible to the public and our stakeholders. Access. And then also the obligation to maintain veterans' confidentiality. So we have this kind of risk management tool, differential privacy, of potentially balancing those three, each of which are critically important. So the federal government, without differential privacy, we're usually very good at balancing two of the three at the expense of the third. We can create high quality data and keep it for just internal use at the expense of access. Or we can provide high quality data to the public with various types of disclosure avoidance techniques, whether that's rounding, cell suppression, noise injection, many different things that may not be quite differential privacy, but that's at the expense of accuracy, potentially. And so then differential privacy, with a mathematically measurable way to ensure that this data maintains fidelity with the original data source, if done properly, is a useful risk management tool. And it's risk management, not risk elimination, because once you disclose any data, there will be risk. That allows VA to provide high quality data to the public while minimizing the risk of violating our legal obligation to maintain the confidentiality of veterans, their families, and their caregivers. And then I'll pile along with that to piggyback with Amanda was talking about AI and machine learning. AI tools and machine learning can only do what the data allows it to do. And oftentimes when you have underserved or underrepresented populations, those are typically the cohort that's usually mostly impacted by these privacy preserving techniques. If you think about very, relatively small racial cohorts, they get aggregated to where the nuance of their characteristics are usually hidden. And so machine learning tools can't really predict the small changes in their population. AI can predict a very small change in California, that might be a very big change in Guam. It might be a very small change among white male veterans, but that's a really big change among tribal affiliated veterans. And so differential policy allows us to beyond ensuring confidentiality, accuracy, and access, it also allows us to train our analytic tools to really get at nuances to address our foundational equity concerns in a way that still preserves veteran privacy and provides accurate and high quality data. Thank you.
Thank you, Eddie. It's very important, I think, for us to talk about that trade-off. You can't have it perfect in all three areas, right? And pivoting off that risk discussion back over to Brant. So I know in the paper we identified risks at every one of those levels in the synthetic data the life cycle. So can you talk about some of the risks the paper identified with respect to implementing future policies for synthetic data use?
Yeah, thanks, Mary. In the interest of time, I won't go over everything that we identified in the paper, but in short, there have been a lot of advances in the field. There's been a lot of progress in things like dedicated conferences to approaches such as differential privacy. There's been a lot of progress in government by leaders in the VA, Census, IRS, NIST, HHS, and others. But I think what we try to characterize and describe in the paper is a situation where across this idea of the synthetic data lifecycle, some existing policies do provide coverage for some of these earlier phases or different parts of it in the middle. But in terms of a comprehensive policy across that entire lifecycle, these policies don't exist, kind of like what Dr. Clancy was talking about. And this is partially due to the field still being developed and refined, siloed progress. But what we do have in place with respect to policy, I think, is more of a function of it just not being able to co-evolve with the field. And it's in need of interagency focus and revision and invention of policy for this governed use of synthetic data. But so just to more directly answer your question, though, with respect to some more concrete examples, in the data set, in the data sources category of it, we sort of talk about a need for standardization to characterize, ground truth. What is it? And what are some caveats or things to think about for eventual synthetic data use? And it's all in the effort of making downstream efforts safer and more effective. For the data generation and validation piece, we call out a need for metrics, methods, and accessible tools for determining this privacy utility trade-off, which is one of the biggest challenges of synthetic data. For data management, a need for documentation to facilitate reproducibility, policies to guide secure management of the data once you've been able to create it. How do you treat it compared to the original data, for example? And then governance policies to ensure ideas of things like intermingling risks that might cause confusion with the synthetic data sets with original data sets. And as it becomes more prevalent in government, this intermingling topic or idea is probably going to become even more important. And then for data use, aligning synthetic data use appropriately to use cases, ideas of importance of data features such as outliers, whether that's necessary in the synthetic data set, because that also introduces ideas of inadvertent data leakage if the outliers are sufficiently characteristic of the original set, and also consideration for nefarious uses. Policy should really be focused on that to also protect against it. So in short, I think the policy needs we identified could really be abstracted into these ideas of data security, data utility, and ultimately engendering trust across all users for adoption.
Thank you, Brant. I'm going to go next to Dr. Purnell on a topic that I know is near and dear to her heart. So I know you're working with synthetic data to improve the deeply sensitive topic of mental health of veterans. Can you speak about the Suicide Prevention Grand Challenge that you have going on?
I am so excited to speak about the Suicide Prevention Grand Challenge. I noted earlier, this has been a high priority. So suicide prevention is a key priority for the VA and has been and will continue to be. As noted, we hosted a cross-programmatic VA Data Summit for Suicide Prevention back in 2020, and I was grateful to be part of that effort. So I want to also note the key comments that just I'm going to pile on, I guess, the excellent comments being made already, that we need a data set that's fit for the right purpose. So in the Suicide Prevention Grand Challenge, we're seeking bold innovations to save lives and reduce veteran suicide by at least 10%. So if we're going to have an audacious goal of reducing veteran suicide by 10%, we need audacious resources and audacious partnerships, and we need meaningful, novel, and secure data as a component for a novel solution to this wildly complex problem. We know that data will be one component, because in addition to good information and new sources of information, we also need community partners, radical partnerships, collaboration across many government partners, academic, and industry partners to really come together in a multi-stage effort to work together to solve an important problem like this. One target area that we're really interested in is what we're calling digital life data. So this is novel sources of data. So all of us are engaged, whether passively or actively, with the many devices of our lives. And those devices collect data and they tell us something about our well-being. How might we make use of these novel sources of data in a privacy-preserving way, in an equitable fashion that allows us to design and develop better early warning systems? So as Dr. Clancy noted, the VA has the second largest crisis line in the world and has for many years. What might it be like if we could identify individuals in crisis prior to crisis? How might we better proactively engage veterans prior to crisis, thinking about their communities, their families? This is such an extremely important effort. And I think we need all of the best and brightest minds to help us. And that's where sort of increasing access to meaningful information to help engage more problem solvers on this important project is so important. So in addition to sort of proactive warning systems, in increased access and use of an appropriate use of the Veterans Crisis Line, as well as how might we develop systems to engage lethal means safety or improve lethal means safety, as well as firearm access. So we're on target to launch phase 1 this summer. You can see more information about this challenge on challenge.gov. We plan to maintain this grand challenge for many phases, with the reality that this is a complex, long-term problem and will require many problem solvers. So I'm excited to actualize on the potential for synthetic data as one component that might bring us to the audacious goal of reducing veteran suicide by 10%. Thank you.
Thank you for that. I'm actually going to break with the agenda here and stay on you for a minute. Amanda, you had talked about the best and brightest minds. So, and then we have tons of folks on the line here who are from industry and who I know want to contribute, as we all do. So how can we engage our industry partners to get involved with this problem of synthetic data? What are your recommendations for those of us that are in industry to get involved?
Ooh, I love that question. I think that Eddie spoke about this, I think, really beautifully. So we need to engage a variety of people in clearly delineating computationally the privacy and utility, as well as equity qualities of synthetic data, so that we can better characterize this methodology will be useful for this problem with this kind of data for this use. So I think we're really excited about partnering with our academic partners, industry partners, and other governmental partners. To name just a few government partners, we know that AHRQ, the Census, HHS, multiple governmental partners are moving forward on synthetic data and differential privacy in combination as a strategy for increasing access to data to solve problems. And where we really need additional support is continuing to validate the quality. So there's the kind of, is this useful? Is this data meaningful? As well as privacy preserving. NIST has been very involved in privacy preserving metrics. So industry can get involved with continuing to tell the story of the work that's being done and actualize on use cases. So the more that this is part of a public conversation, the more that people can speak about synthetic data and understand what it means, and we can feel more confident in the use of it for specific purposes. For the Suicide Prevention Grand Challenge specifically, there will be opportunities for academic and industry partners to participate in the Suicide Prevention Grand Challenge, and you'll see more updates on challenge.gov.
Thank you so much for that. And I did go over there and look at it. It looks very exciting. All right, Eddie, you're up next. And then what we're going to do after this question for Eddie is we're going to go to the audience and see if they have any questions that for the panel. So if you have a question, if you could put it in the chat at this point, and Tino, who's one of our other authors, is moderating that chat, and he is going to queue up any questions that the audience has while Eddie answers this question, which might be the hardest one, I think, yet. So Eddie, one of the things I wanted you to comment on, which I know that several people, including myself, when we first started, are confused about, is the difference between differential privacy and synthetic data. What are those terms? What do they mean? And then how do you see the adoption of differential privacy within the government happening?
Okay, so thank you for that question. This is kind of my back of the envelope definition of differential privacy. Differential privacy is a mathematical definition of privacy, and certain algorithms can be said to have that. You satisfy differential privacy if the output of the algorithm does not differ significantly when an individual is either included or excluded. So an outside observer cannot conclusively identify whether the individual's data was present or not. And so then synthetic data is just an example of differential privacy, because it speaks more to the quantifiable aspects of the privacy preserving technique. There are many different types of privacy, but differential speaks to the mathematical or the quantifiable aspects of that particular privacy preserving technique. And as far as how government's using differential privacy, and I'll speak primarily to synthetic data. If I start with VA in particular, our National Institute of Artificial Intelligence, and along with VHA, our healthcare system, they can use differential privacy or synthetic data to kind of reduce the barriers of entry for developing research. Diagnostic models can be developed, not just internally, but leveraging academicians and other researchers to kind of help enhance these models and refine these models to help VA provide better diagnostic capability for things like prostate cancer. And of course, as Dr. Purnell mentioned, suicide prevention, one of our key priorities. I sit on the Inter-ADC Council on Statistical Policy as statistical official. And over the past year, I guess the latter part of last year, we've been assisting the advisory committee on the advisory committee for data on evidence building to compile an inventory of projects, pilots, and use cases of how federal agencies share administrative data. A large part of that is how we preserve privacy sharing that data by leveraging differential privacy or synthetic data. And I think as of late last month, January 26th, there's a list of about 82 different projects that speak to how federal agencies are partnering either in isolation or partnering to leverage synthetic data to provide data to the public and to other federal partners. Census Bureau, of course, is out in front. I think of that list of 82, there's about a third of them that are sponsored by Census. Most readily available is how we access public use files that Census generates. The American Community Survey is an example of differential policy, differential privacy, particularly ACS 2020 because of the pandemic and because of challenges relating to respondent rates. The ACS 2020 public use file is a prime example of leveraging differential privacy and synthetic data to provide data to the public. Outside of that, we have the National Science Foundation is developing or has developed what they refer to as America's Data Hub. It's a research center of excellence with academicians, nonprofit, for-profit, large and small businesses that securely shares and links synthetic data assets to solve complex real-world problems related to economic recovery, racial equity, and the impacts of COVID-19. Going back to Census, there are a series of projects that they developed called Evidence Project. There's one for FY20, FY21, FY22. The FY20 project was centered around leveraging, we're looking at all of the various surveys across the federal space. And how do you take these sample surveys and make that data more useful to the public by exploring and collaborating on privacy preserving techniques or leveraging synthetic data to make that data more available. Many of these surveys, of course, are protected by CIPC regulation, but the data is not shareable outside of that agency, or you might need some special data use agreement, which are very costly and timely to develop. But so they've embarked on this challenge to really dig into how can we make privacy preserving techniques, specifically synthetic data techniques, not standardized, but more available to all these agencies that collect sample surveys and make that more available. There's also an effort, this was the last year's effort for secure multi-party computation. And the idea, without getting too technical, is BLS and BEA have a methodology that they use to report out on business activity. The Census Bureau is trying to mimic that methodology using synthetic data and ideally breaking down the barriers and the time constraints to where the BA does not have to go through Census to access IRS data to perform the analysis. They can actually use synthetic data, and that a huge savings in terms of times and funds. And speaking of IRS, don't get too excited. This one is more so just an idea that Treasury has put forth. It's an idea for a pilot project, but it's not underway. And I know many people might be excited about this. It's how can we use synthetic data to create public use files of tax data linked with demographic data? Now for VA, that would be fantastic. And I'm sure many other agencies will love that as well. We understand that tax data is very useful in the research space, in the operational space, but getting access to that data literally takes an act of Congress, unless you're partnered with Census. And so the ability to use differential privacy and synthetic data to make that data more available, and specifically link it with demographic data to really look at how tax policies affect different racial and demographic cohorts across the country. Again, there are many to go through. I listed a few, but that's kind of a few examples of how different agencies are leveraging synthetic data, either to improve their own operations and their own open data programs, or to collaborate across the federal space to make that data not just useful to federal agencies, but also useful to other researchers, and really plays a big part in reducing that barrier to entry for collaboration among the federal community. Thank you.
Take a little drink of water there, Eddie.
Absolutely.
Because I think I got another question coming for you. All right, so those are the preset questions. We wanted to go to the audience and see if there are any specific questions that the audience has. And I see that Bobby put one in the chat here. Bobby is also one of the authors of the white paper. And he says, as far as synthetic data policy, do you feel that it's better to engage with other agencies, Census, NIST, IRS, for an overarching policy, or to start within VA? And you can answer that if you like, or one of the other panelists can take that.
The simple answer is yes, yes, and yes. I think that is the best way to operate. Only because the real benefit of synthetic data is not to be used internally. We have access to our own administrative data. The real benefit is how can we share that data with our federal partners and the public at large. And you want to do that in a very consistent, standardized way. And I think it was Brant who talked about the idea of intermingling, really understanding the implications of intermingling data and being able to clearly identify, delineate between original data and synthetic data, and developing those metrics and standards with our partners, I think is critical. So I think absolutely, you really want to start with leveraging the federal community on the onset and not just operating internally, because again, we have access to our data. That's that part. We have confidentiality, we have accuracy. It's the access part that synthetic data provides. And I see Kshemendra has his hand up.
Yeah, I wanted to highlight that there's a nascent discussion that I'm really excited about to, follow on to this event with a workshop. And just to clarify, so we are working with our interagency partners. So Eddie is our VA statistical official. He's plugged into the Interagency Committee on Statistical Policy. We've been talking to them. They have a data protection toolkit. They're very interested in this area. A lot of work there, the Chief Privacy Officer Council, and then I'm part of the Federal CDO Council. So there's a real interest and desire. And while VA is very committed to these ideas, we need to work in lockstep with our federal partners and make sure that it's a broad-based approach, because that's the only way effective and sustainable risk-based policy can be made. I also want to, acknowledge that Dr. Clancy, for mission reasons, needs to leave at 10. So I wanted to come back, make sure we had a chance to come back to her on either questions or get her into the conversation.
Yes, absolutely. Actually, the question that's in the chat might be a good one for Dr. Clancy. You can wave off if you're not comfortable answering it, but it's a base question. How is synthetic data better than traditional anonymization methods? Is that something that you would like to answer, Dr. Clancy? Or is she gone?
I testify at a lot of hearings. So the first thing you do is to say, that is such a great question, and then answer the question that you actually want to talk about. It is a great question. And as Kshemendra and Eddie had mentioned, they're identifying many other agencies working in this space. I was really, really thrilled to find that some of my former colleagues at the Agency for Healthcare Research and Quality are all over this because they've had years and years of experience with data. And by the way, privacy policies from all 50 states, because we used to have hospital discharge data from all of those 50 states. I think I'm not sure we're going to come to an answer as in synthetic data is 80% as good as or 120% better than anonymization. But I'm going to tell you what I think is an urgent application that excites me about the opportunities for synthetic data. VHA, or the Veterans Healthcare Administration, often says that we're a learning healthcare system. This is just a buzz phrase. Across healthcare, it can mean whatever you want it to mean. What happens to us is we've got a phenomenal research group, including the fact that they've got as an asset probably the largest collection of individuals. Genomic is called the Million Veteran Program. They're close to 900,000 now. And it's not just their genomic data, because it's also linked to their clinical data. That's what makes it literally unique on the planet as far as we know. They're doing phenomenal work. Our people in operations, right? The people who are dealing with Omicron, dealing with employees sick from Omicron and so on and so forth, they've got to make fast decisions. And getting to data just feels like, oh, no. I need something far more rapid than my going through the usual privacy hurdles. That could take months. Now, yeah, we can tell the privacy people to speed it up, but I actually think this could allow, synthetic data could allow much faster learning. If you don't have to wait for approvals for original data, we can test a variety of ideas. And to make this real, last year was a down year for us in terms of the number of trainees related to the pandemic. We're talking 113,000 across our system every year. That is a lot of future healthcare workforce, many of whom have as a training requirement, I would say completed to varying degrees of fidelity, the need or opportunity to do some kind of research project. Okay, you wanted to improve care for veterans with diabetes. Show me how you made a difference. Now, if you can't get to data, people make up a variety of strategies and probably get a pass. But to actually make this real, that would just be so awesome. And I think this would work both for internal users as well as for catalyzing partnerships, which is also very important to us because 78%, Kshemendra and Eddie can tell me if I'm a little off there, of the veterans in our system have other insurance. So sometimes they get care from us, sometimes they get care elsewhere, especially for Medicare. Hearing aids, that's all us. We own the space because we pay for them, Medicare doesn't. But for everything else, the opportunity to be able to map a veteran's journey in terms of how we can serve those veterans better is just awesome. And we need to get there. So I think we started off on one island and I took us to another, but thank you for the opportunity.
No, that's exactly what this is all about, is a open discussion. And thank you for joining before you have to leave off. It was a pleasure to have you here. Amanda, I know you've got some comments here. You've been sitting quietly. And I know you have a whole list of topics that you're very passionate about. I have a question for you, but do you have comments on what's been said yet to date?
Oh, so much to say. I similarly actually have to also drop at the top of the hour because I'm going to the Suicide Prevention Grand Challenge Planning Committee. So it's an important thing that I need to do. So I think that there's some really great questions in the chat. Where I want to jump off first is to enhance a point that Eddie made, that what I think synthetic data does from the core thing it does is increase access. So it increases the opportunity, as Dr. Clancy noted, for trainees to get quick access to test ideas, to iterate on quality improvement projects, and to improve the already excellent care that's being provided in the VA by making it even better. And it also improves the ability for us to partner with other federal agencies, share meaningful information, and really improve the quality of care. Our goal is to improve the quality of care and to serve veterans. So from my perspective, what synthetic data does beyond de-identified data is increases access to more people for solving problems together. And I wanted to add the point that Eddie alluded to about how we might even use federated data, which is another privacy preserving technology where you're not moving data around. So how might we make use of these privacy preserving technologies in order to better serve veterans and to use the right technologies for the right use cases?
Thank you so much. And in interest of time and knowing that we have to pop off, I'm going to go back to Eddie or Brant. Either of you guys can answer this next question, and then we'll give it over to Bobby for a wrap up in about 3 minutes. So this was one of my favorite questions. My background is mathematics, and this is what makes me excited is about data privacy and data usability are on opposite sides of the scale, as Eddie was talking about earlier, and they have to be balanced. And again, more usability is less privacy. So that whole tuning parameter of how do you tune that? Is there a way for us to put into policy that this what we call the epsilon number, the parameter is acceptable or it's not? How do we see that adoption moving forward? Are you good with, you want to answer that, Amanda, or we can ask Eddie to do that as well?
I'll give a quick, it really depends on the use case. And we can certainly hard code epsilons into policy, but it really depends on and I put in the chat, the nature of the data, how sensitive it is, So I mean, there should be some guidelines about, how we measure it, but I think it's really difficult to hard code in a policy. This is how we should measure all synthetic data assets, because again, it might be overkill for certain use cases. And so there should be some technical guidance there, I think, but I'll defer to Kshemendra and Brant for follow up.
Yeah, I wanted to jump in the conversation, then hand it over to Brant. I think the key idea, Dr. Clancy brought it up, Amanda, Eddie, right? If we can lower barriers and speed up cycle time, right, with access to data, we think that's really going to be doing a great service. And a lot of that's use case driven. Now, the straw, kind of policy that we hear from OMB out of the statistical community is the idea of tiered access, maybe a validation service, right? So can you put something out that's accurate, allow folks to dip a toe in the water, develop a thesis, right? And then come behind a firewall or sign an information use agreement and get the next level, right? And that kind of tiered access allows for a more nuanced policy determination. Obviously, you got to trade that off with, when are you washing away signal, right? As Eddie was talking pretty eloquently about those trade-offs, so that becomes an interesting way to do it. But I think many of us think the idea of speed and access and more timely disclosure is so valuable, right? To move the conversation forward. We don't have to solve all the problems to be able to, take that sort of a step, right? And put something out that's more timely, more, but maybe much more locked down, so to speak. But over to Brant.
Yeah, thanks for that. I totally agree, Kshemendra and Eddie, with your comments on this. In particular, I love the idea of considering it with respect to the use case and those nuanced policies for it, because the way differential privacy might be looked at is not with respect to the entire synthetic set, but more to specific columns that might require that versus others, and other columns might be fine with obfuscation or some other de-anonymization techniques. So I think the use case and the methods used are really going to drive a lot of that. I think it goes to Haley's comment in the chat about policies from generic to methods, or would it be specific to other things? Something that comes to mind is that there's a couple ways of looking at it. Generative adversarial networks and other deep learning methods use original data to learn from to create synthetic data, whereas other methods pioneered by MITRE and others look at statistical properties in terms of distributions and then calibrate synthetic data sets to that, so they don't really start from individualized records, and that might do a lot to protect privacy in the synthetic set. So I think it's a very complex answer, and why I think, Kshemendra, you brought up, there's this really exciting continuation of the discussion that's going to be necessary to kind of tease some of this out.
Thank you, Brant. Thank you to all the panelists, all the speakers today. I know that this has been, for me, invaluable, and lots of folks in the chat have said that they enjoyed it as well. So if you guys could click on the link that Bobby put in the chat and join the Health CIO, you'll be able to follow us in the future. And then back over to you, Bobby, to close out.
All right, Mary, thank you. Kshemendra, I need you to say something so that you become the main focus here, so I can get a good screenshot that I can post.
Great smile.
All right, fantastic. Okay, so thank y'all so much for talking about this topic, for asking us to get involved, and for being such a great partner. It speaks volumes that we had 4 people who have more important things to be doing at the VA right this second, who spent an hour with us today talking about this. So thank you, Kshemendra. Thank you, Amanda. Thank you, Eddie. Thank you, Brant, as a panelist as well as an author. Thanks also to Dr. Clancy for her sage advice on that was a great question, and then answer the question that you want to. I'm going to use that tonight at another event that I'm attending. I also want to thank all of the authors again of this. And there were a lot of folks that were involved. And again, I strongly encourage you to go out there to the ACT-IAC website, find this paper and read it. This is valuable, readable information. And if you're just kind of semi-excited right now, you will be excited when you finish that paper. And thanks to all the attendees that came in today. We had over 36 people that were here just to learn. And we really appreciate you coming in. That really speaks to the message and the mission of ACT-IAC and a partnership between industry and government. And we appreciate you being here. If you were here today and you did not get a message from me on LinkedIn, that means I could not tell if you were one of the 10 Tinkers, for example, but find me, reach out to me and get in and connect with me. If you want to be more involved, because this is the starting point for this paper, this is the starting point for this discussion, then reach out to us. Reach out to Nancy Delanoche or go to the Health COI or ACT COI website and or send me a message on LinkedIn or one of the other members of the Health COI team. That's Kelly Winter, you remember, Ton Pantesi, Elijah Biggs, Casey Harris. Send one of us a message because we have more things planned. And we are starting here with the VA. And thanks to Kshemendra and your senior leadership on this, this is a topic that we are going to make the topic across the federal government over the next few months. So thanks again, everyone. Y'all have a fantastic day. And thank you for attending. Bye-bye.
Thank you very much.
Goodbye. Thank you so much.